You have seen an excellent presentation of formulation and management of a case of recurrent depressive disorder. This kind of a case can be kept in the exams to assess student skills in risk assessment and management of suicidal risk and discussion of treatment related aspects of treatment resistance. In this presentation, you would have observed how the discussion revolved on both these aspects. Detailed risk assessment and management was discussed. Stepwise treatment options in case of resistance with evidence base such as STAR-D was discussed. This discussion showcased to the examiner the student's knowledge in both pharmacological and non-pharmacological management. An important part of discussion in such a case is also the use of technique of ECT. A few suggestions regarding this presentation are: 1. Formulation can be made more concise by giving only relevant past history. For example, it may suffice to say that the patient has had 3 episodes in a duration of 5 years, last episode being 1 year. This will save you time. Please do see the video on formulation by Dr. Naren Rao. 2. In such a case where discussion is on emergency management, mentioning non-urgent investigations like vitamin B12 can be a distraction and take the examiner off track. Discussion on emergency care will fetch you more marks than discussion on B12. 3. The student here mentions bifrontal ECT. While this may be correct as per evidence base, many centers in India may not be following this practice. It is best to say in an exam setting what is done in your hospital. It's safe to say bitemporal ECT or unilateral ECT while monitoring for cognitive adverse events. 4. The student mentioned a meta-analysis for ECT. Unless you are very sure about the findings of this study, it may be safer to avoid mentioning meta-analysis. If the examiner gets into specifics of one particular study, you may not have all the answers. However, important studies like STAR-D, the student is expected to know. Some common mistakes that can be made in a case like this include forgetting to consider possibility of bipolar disorder as a differential. You may not have got a history of hypomania in 45 minutes. You must say that you would like to clarify history for this again later. One must not forget to mention the important role of 24-hour close monitoring and risk avoidance in the ward and nursing instructions such as not to leave patient unattended, keep away access to loose clothing, medication, sharp instruments. This can happen when the focus is too much on ECT and investigations in the discussion. The Mental Health Care Act admission procedures will be a favorite of the examiners. You should know the procedures to be followed as per MHCA, including capacity assessment, nominated representatives, advanced directives, etc. Non-pharmacological management should be tailored to the individual patient rather than generic therapies. Please see the video on general principles of management. It is important to differentiate between treatment resistance and pseudo-resistance. Evaluation including clarification of history for missed hypomania, past treatment history, whether adequate trials have been given, presence of personality factors, stressors, medical conditions which may contribute must be mentioned in your assessments in the management plan. Hope this video has helped you in your preparation for an exam case of recurrent depressive disorder. Thanks for watching.